The views and opinions presented or callers on this program do not necessarily represent the positions of WMBS Radio.
The information you will hear is general information about health insurance. If you want specific health insurance advice, please call the Health Insurance Store at 724-603-3403. The host or guest may not be able to mention specific health insurance companies. You cannot change, purchase, or bind any insurance policy over the radio.
Welcome to What's on Your Mind. We got a special show today for all those listening out there. This is Josh Krysak with WMBS. I am behind the board with the help of TJ DeStefano, the best production man in the business. First time behind the board for me. And I am here with an old friend of mine, a good friend, and a friend of the station. Haven't seen him in a little while. Aaron Zolbrod from the Health Insurance Store. Aaron, how you doing?
Good, Josh. Good to see you, man. I walked in and saw a friendly face. That was cool.
Yeah, absolutely. And you're doing what you normally do, flying in last minute. But hey, you're the man with the answers, and I know the reason you wanted to come back and the reason you're here is we're getting into that time of year where there's a lot of questions. A lot of people are starting to get the emails, get the calls, get the texts like, hey, it's almost time to renew,
get the stuff in
time
the
to
mail.
look at it. So what are we talking about today?
So we've got two enrollments periods that are coming up. Okay, so we've got the one that's on our doorstep, which is the Medicare annual enrollment period. That runs, what we call pre-enrollment starts on the 1st. What's today, the 29th?
29th. 30th.
So in 2 days.
Yeah.
One day, or tomorrow the 1st.
Today's the 30th. Tomorrow's the 1st.
Starts tomorrow. That's pre-enrollment for
Okay.
Medicare. That's when everybody can see all the plans. They become public, and that's from the 1st to the 15th.
Okay.
On the 15th marks annual enrollment period when you can start changing your plans.
Okay.
And so we've got a lot going on. Specifically, what I want to get into today is talking about drug costs, because drug costs for most people on Medicare Advantage plans, which are the choice people have to privatize their Medicare, which are HMOs and PPOs, their drug costs are going up. For probably 1/3 of people that happened this year. For the other 2/3 of those on Advantage plans, that's coming up in 2026.
Okay.
And so this is the time that those people can look into the possibility and the opportunity to change those plans, see what's out there that could keep their drug costs a little bit lower. It's not going to affect everybody, so I'd like to get into that a little bit and talk about that portion of Medicare specifically. And we're only going to be on for 45 minutes today, so we've got a lot to cover in that 45 minutes. But that specifically is important for our listeners.
Yeah,
if you have a Medicare Advantage plan, it's HMOs and PPOs.
Okay.
Your drug costs are probably going up especially if you take Tier 3 medications.
So what's it? So for listeners out there, what are we talking about with Tier 3?
So Tier 3 would be generally brand name.
Okay.
These are expensive brand name drugs. They average about $600 a month in retail costs.
Okay.
The big ones right now are Ozempic,
Sure.
Trulicity,
Wegovy.
Well, Wegovy's not for diabetes; it's for weight loss, so that's not
necessarily
not covered. So,
gotcha.
But we have tons of people on those non-insulin injectable medications: Trulicity, Mounjaro, Ozempic, a couple other ones. Those are $1,000 retail.
Okay.
What's happening is we're going from where you had little or no deductible for those meds, and then only paying a flat $45 or $47 copay per month. The big change for next year is we're going from a flat copay to 20 to 25% of the retail cost.
Wow. So what were the flat copays? What were some of the
$45, $47.
So if you're looking at $600 and you're paying 25%, you're going to be paying a lot more money.
But those Ozempic and Trulicities are $1,000 retail.
So you're
$250 a month.
Unbelievable increase.
Now, there is a cap on what somebody can be billed for medications in a calendar year of $2,100. But those people who had those drugs, who were on plans that had little or no copay or little or no deductible and a flat copay, we're spending, say, $100 to $200 in deductible and then $45 times 11. So they were spending about, $700, $800.
Right.
Well, next year they're going to spend $2,100.
So a big hit.
For the same exact medication.
Yeah.
So for people who are taking one Tier 3 med, they're looking at spending $1,000 to $1,500 more for their medication next year than they did it this year. So that's a big
I would say
deal.
so. And now that's specifically, like you said, for Medicare Advantage, HMOs, and PPOs.
Yes. Now, people who have supplements, they purchase what's called a standalone prescription drug plan. They were already in that boat. Okay, so this is not new for them.
They're already there.
They're already been paying that money, so they're used to it. But again, 2/3 of our clients. There's 3 major companies that sell HMOs and PPOs in our area. I'm not allowed to mention them, unfortunately, by name.
Okay.
So one of them went to that this year, 2025.
Okay.
The other 2 are going to that big difference this year, to where you're going to pay that extra money. So those people are in for listen, things are hard, Josh, right now for people on fixed income. It's hard for everybody.
It's a tough time.
It's I talked about it today.
Instability. A lot of questions.
Talked about it today with my agents. I said, look, we have to be empathetic that people are struggling, that they're paying more money for their, utilities, more money for their groceries, more money for their insurance, more money for drugs, more money for everything.
Yes.
And this is a hit.
Yeah. That's a big hit. There's no question about it.
$75 or $100 more in drug costs, and then your premium may go up $10 or $12 or $15. You have some copays that are going up a little bit. I mean, it all adds up. And so, again, this is the time, if you are in this position where this is going to be hard for you, that you can come and see us and let us do our thing.
Yeah. So if people want to find you.
Yes.
Where do they find you?
Well, they're going to find us you can call us to set an appointment. It's 724-603-3403. Our website's getyourbestplan.com. If you just want to go on and peruse the website, we put some columns on there. I write columns every week called Ask the Medicare Specialist. I'm going to address these things in those columns in a question and answer. But if you want to make an appointment and come sit down and let us, this is our thing. We listen, hear your dilemma, hear your problem, and then we help you find a solution.
Got it.
It may be changing plans.
Yeah.
There are still some limited plans that can keep your drug costs down, but might be some sacrifices to get lower drug costs. You might have to give up something else.
Right.
Okay, that's what we do. We'll also help you find, maybe you qualify for PACE or PACEnet, which will eliminate those drug costs. There are what's called patient assistance programs. Those are programs through drug manufacturers that can help get you your drugs at no cost that have a higher income levels.
Right.
We go on Canadian drug pharmacies and find drugs for cheaper for people.
So you're working for each individual to try to meet the needs that they have.
Yeah, I mean, and there's very rarely not a solution. I mean, I think it's getting tougher and tougher for us. Our job's getting tougher.
Yeah.
And Lonnie laments about this all the time, that used to be it was everybody who came in, it was so much fun that we'd say, oh, you're paying $280 for your Medicare Advantage plan. Here's one that's exactly the same practically that is for $26. And, well, we've done that. We've made those changes, and now we're running into people that, we've helped them in the past, and now they're getting hit with these extra costs, and it does become a little more difficult to find a solution. But if they're there, we will find them.
Absolutely. So I can speak a little bit, and that's what the show's all about. I can speak to that myself. I had a background in healthcare. Worked at the hospital for a decade.
That's how you and I met. Mm-hmm.
Yep. Kind of left there unexpectedly, and then I was on my own and needed insurance. So I knew who to call, and I called you guys, and I hooked up with Tony. We went through plans, so he helped match what I needed at this time of my life. And I think that's what you guys really do.
That's exactly
everybody's in a different spot.
There's no one size fits all approach.
Yeah.
So we're gonna listen. First of all, listen. You're going to come in and say why you're here.
Yeah.
We're going to ask questions. Mm-hmm. What do you travel? What hospitals do you need? What can't you live without? What's most important?
Who's your doctor?
Well, yes. Who's your doctor? What medications do you have? Do you happen to have veteran coverage? What's your income to see if we qualify for PACE or PACEnet?
Right.
We're going to ask a lot of questions, and then we're going to find out. We're going to find the spot that works for you.
Right.
There's a couple new plans. There's a couple new plans that are in our market this year that we think might provide relief for people that are new, and here's the thing though, Josh, we're year to year now. This is not something that, because we're at this point with healthcare, with health insurance, that things are changing so much. Prices are the cost of healthcare are rising.
Right.
Medicare is in trouble financially. The country's in trouble financially. that this is an ongoing year-to-year
So
thing.
there's no set pattern
No.
for you. You're looking at it new every time.
Yes.
Yeah.
I mean, so what we might find for you this year, so there's a new company coming in our market that's very competitive. They have lower drug costs. So we might take you and move you to them for this year.
Right.
For 2026.
And
guess what might happen next year?
you may go back to where you were or somewhere else.
That company may also have to do the same thing and employ drug deductibles and higher costs for the drugs too.
Yeah.
And so we have to do it again.
Yeah.
And so now more than ever that you need an agency, and a lot of our listeners are already clients.
Sure.
But if you're not our client, more than ever, you're going to need an agency that cares,
Yes.
that keeps track of it,
Yes.
that's going to connect with you throughout the year and advise you and give you direction.
Right.
What we're starting to do now, Josh, is we're starting to send emails out 3, 4, 5 times a year, letting people know what the PaceNet qualifications are, let people know if we discover something, hey, we found this drug that's less expensive over here.
Sure.
We found this program, here's something new. We want to warn you, we want to warn you about this. Hey, make sure you're using all your extra benefits because we feel like they're going to be lower next year.
Right.
We're always sending our clients out information to stay ahead of it, save them some money here and there where we can, because that's
the name of it. Yeah.
that's where we're at.
Yeah.
I mean,
so I think it's really good to have. It's the first time I've got to share the airwaves with you. I think it's really good to ask some of those questions too that I know that I had when I first was coming in the door.
Yep.
I thought, well, I'm going to have to pay for this service. I'm going to have to pay out of pocket to a third party to then negotiate for me. But that's not how it works.
I'm glad you brought that up because I always forget to do that. So
it's important. People
it
need
is
to know.
important. Whether you can come to us.
Yeah.
So we're brokers.
Yes.
That's important. Something I don't also say. That means we are appointed to provide plans from every competitive company.
Yes.
So we're not biased.
Right.
You tell us a situation, we listen, then we match you up with the company and the plan that's going to work. So all the companies that work for you, we don't charge. So whether you come to us directly or go to the insurance companies,
Right.
number one, we don't charge anything. It's the same price as if you called the insurance company directly.
Right. But you're going to look at all the offers.
Right. Only you call insurance company X, they're not going to give you insurance. They're only
Right.
going to give you insurance company X's products and choices. They're not going to compare them to insurance company Y and Z like we're going to do.
Right.
And we're blessed to be able to do that and be unbiased. So there's a lot of different reasons. The number one thing is we do care. 18 years, man.
Right.
In April, 18 years the health insurance store has been open.
Yeah.
Over 20,000 clients
Yeah.
that we've helped, way over 20,000.
Right.
We have 15,000 active clients.
And I know you take it based on things I've heard you say in the past and the interviews you've done. You take it very seriously to do the best you can by those clients.
We're always going to do that. I mean, that's just what we
That's
do.
what it's for. It's not- yeah.
That is what we do. That is how we do it. That is why we have 15,000 clients. It is why if you talk to 2 or 3 people and they're going to tell you go to the health insurance store.
Yeah.
If we are the go-to place in Fayette County and the surrounding counties. And you know what? We owe a lot of our success to this radio station. This is where we got our start 18 years ago, coming on this show and talking about it. So we appreciate that. And number one, we want to educate. You got to have an education.
Yeah.
That's what we do. First and foremost, we're going to educate you on how Medicare works, how supplements work, how Advantage plans work, explain the pros and cons, the risks and the rewards.
Right.
And you can't make a decision without being educated.
Yes.
And so that's what we want to do. So again, Medicare season is here.
Yeah.
If you want an appointment, if you found now again, our clients, you should have gotten your recommendation letter. We had a few stragglers that we just sent out yesterday. But one thing we do, Josh, is we send out letters to every single client, Medicare client,
Wow.
over 12,000 letters,
Yeah.
letting them know the goal is to have them prior to October 1st to let them know what changes they can expect, if we're concerned about those changes, if we think they should stay on their plan, or if we think they should come in and let's sit down and compare. So
Right.
our clients either already got that letter, or will be getting it in the next, maybe it was in the mail today or tomorrow, but if you haven't gotten, you'll get it. If you're not a client and you want some advice, just call and we can talk you through that.
Right.
If we think you're on the best plan, we'll tell you. No, don't worry, you're good.
Right.
We can't do any better for you.
Right.
So if you want to just start with a quick phone call, talk to an agent or myself. Aaron, this is what I have. What do you think? Artrell, Tony, who
Yeah.
you dealt with, Lonnie, Sadie, Jen. They'll say, oh, that's what we probably would have told you to take anyways. Or you know what? you're concerned about drugs. Yes, your drugs are going up. Come on in.
Right.
Let's sit down and talk about it and see if there's a better fit for you. There may be, there may not be.
Right.
You know, when we look at things side by side, yeah, we can lower your drugs here, but your hospital copays are going to go up
That's
there.
right.
You may decide, again, we don't know unless we talk about it.
Right. And then again, it all depends on where that certain client is in their situation too. Young, fairly healthy, not on medications is going to be different than somebody who's a little older, on a couple of medications, maybe has a comorbidity. All that stuff changes stuff.
Yeah, I mean, there's people who would say, okay, here's something that can really make a difference now. I only use WVU.
Right.
That's where we do.
Yeah.
I go to Uniontown. I go to Morgantown. So there might be a different choice for somebody that's like that. Somebody who says no, I go to Florida for 3 months out of the year.
That's the difference.
That
yeah.
option's not going to work for them.
Right.
That's a totally different scenario that we have to look at things completely differently.
Right.
So we may say, look, I've got a plan that can lower your drug costs, but it's not going to work for you down in Florida.
Right.
Nix that.
Right. I want to ask you. So we talked about HMOs and PPOs. We talked about the tier 3 drugs. Or what about the folks that are on HMOs and PPOs? Maybe they're not on a tier 3 drug. They still probably have reason to want to make sure that they're exploring what's happening.
I mean, yeah. So look, that's great if you're not on tier 3 drugs. You want to know the best way to limit your drug costs now? Stay off tier 3 medications if you can do it.
Right.
You know, because tier 1s and 2s are always very inexpensive and don't have drug deductibles.
Okay.
But sometimes you don't have a choice.
Right.
Okay.
Right.
Eliquis is a drug that almost everybody who has any sort of heart procedure takes as a blood thinner, preventative blood thinner, for a long time.
Yes.
It doesn't come in generic.
Yeah.
Okay.
So you got to pay for the name brand.
So you're gonna have to take it. So you want to know what to expect in case it happens, and for sure. If you're not on a brand name drug, there's not that urgency. And I wouldn't, honestly, my advice would be, look, because you're not on one, I don't want you to take a plan that would eliminate that deductible in case you get put on one, because you may end up because the hospitalizations are a little more expensive, or this is a little more
Right.
This is a little more expensive. So let's stay where you're at. But again, we can have those conversations, Josh, without you. I'd say 25 to 50% of people we meet with, we don't do anything except say you're good where you're at. Stay with the option through your employer or retiree company you retired from. A lot of times, and you know what? That's a nice sigh of relief to know, man, I am on the right plan.
Right.
So don't be afraid that we'll do that. We enjoy meeting with everybody and providing that relief when we can.
Yeah, absolutely. It sounds like we do have a call here, Aaron, so we'll take that call. Hello, you're on with Aaron Solbrod and Josh. What's on your mind? A special edition, the health insurance store. Who are we talking with?
Hey, this is Bill.
Hi, Bill.
Hey, Aaron. My mom's been with you for a long time. She's 92 and a half. Am I allowed to say her?
You can say it. Yes, you can. I can't, but you can.
She's got UPMC for life.
Mm-hmm.
Does she have anything to be concerned about as far as increases or anything?
There are going to be some changes to how Tier 3 drugs are covered, yes. So if she's on a Tier 3 medication, that's going to be a more expensive brand that maybe she's been paying, just under $50 for. That could increase. Now, let me tell you this. If she qualifies or has PACE or PACEnet, it won't affect her. And so that's what we did send out in the letters, that, look, if you have PACEnet, you are not going to be affected by these higher drug costs, because PACEnet comes in and picks those up. And so there's no need to be concerned. So if your mom's 92 and a half, I'm guessing, she might have a limited income, which means if she's not already on it, she qualifies. So, what I suggest is if you're not sure, call the office, let us take a look, and let us evaluate income for that reason. But, she's got to be, you got to be aware if she's on a Tier 3 medication that, yes, you're going to have some increased costs in 2026.
Okay, can you explain to me, I don't get the tiers on this.
Okay, so that's a great question. Excellent. Let me explain it. Yes. Tier 1 and Tier 2 are generic drugs. Okay? Tier 1s and 2s. Those are generic drugs, not subject to any deductible. Generally, are going to cost $0 to $5 in a copay. All right? Tier 3, 4, and 5 are generally brand name drugs, and some generics can be a tier 3, but the ones we're really concerned about are brand name tier 3, 4, and 5 drugs. Tier 3 are the common brand name drugs: Trulicity, Ozempic, Mounjaro, Jardiance, Januvia, Advair, Eliquis is probably the most common in the country. Those are tier 3 drugs. Now, they had been on a flat copay of under $50 on most plans up until this year for some people, and for most others next year they're going to a co-insurance, which is a percentage of the retail. So instead of paying $45 or $47 or dollars for that medication, if you're on Ozempic, you're going to spend $250 for that drug until you've been billed $2,100 out of your pocket. So it's a big difference for somebody who was on one tier 3 drug in 2025, what they paid compared to what they're going to pay in 2026. Okay, and that was a great question you just asked to explain the tiers.
Can I do a follow-up?
Please.
Like my mother's on blood thinners.
Yep. So
now she doesn't take Eliquis. She takes warfarin.
So that's tier 1. So that's going to be no cost. And she's one of the very few people left that still takes that old drug. Warfarin has been almost completely replaced. But and she needs to go get blood work done every couple weeks to make sure that she doesn't have, because there's something about that medication that has something in it. They want to make sure that it doesn't reach certain levels. And Eliquis replaced warfarin, because you don't need to go get blood work done every 2 weeks, and that's why almost every person is on it. We hardly ever see warfarin anymore. 99% of people who take blood thinners are taking Eliquis, and the other one is Xarelto. So one of those two. So she's one of the few people. So no, she's not affected by that. But take a look. You're welcome to call the office so we can go over it. And the easiest way to protect her, and we'll never need to worry about it, if she's eligible for PACE or PACE-NAP. And I bet you she is. If we don't already have her on it, I bet you she's eligible, and we would enroll her. But my guess is she's been with us so long, we probably already covered that and probably already have her on PACE-NAP if she's eligible. But a phone call to the office certainly doesn't hurt.
Yeah, Bill, we appreciate the call. Those are great questions. Thank you for listening in today.
Hey, thanks,
Bill.
All right, take care.
Hey, you too.
Bye-bye. Oh, that was a great call.
That was an outstanding call.
Those are really good questions, and that just shows you how it affects real-world people.
You know what? And it's not something I came in thinking that we would cover today or had time to cover, the tiers of the drugs. I'm sitting here, and sometimes I'm guilty of that. I'm sitting here rattling off tier 1s, tier 2s, tier 3s, and forget that I've been doing this for 20 years.
Right.
It's not something that our listeners are we're starting to become more educated on it, but it's not something that is in our everyday vernacular. So correct. I'm so glad Bill called and asked that question.
Absolutely.
And again, we're not going to take everybody's phone calls today. We're limited on time. Just call the office. If you're a client, if you're not a client, we'll answer any question that you do have. You can email me directly if you want. So the phone number at the office is 724-603-3403. And you can email me directly, and it's Aaron at getyourbestplan.com.
Pretty simple.
Pretty simple. Aaron at getyourbestplan.com, AARON. You just send me your question. You can say, Aaron, I got XYZ plan like Bill did. My mom has this. This is what I pay for it. Tell me what I can expect my changes. We'll tell you. Am I good? Yep, you're good. Or, I would recommend you come in. Let's compare and contrast and see where we're at. Or, let me ask you a couple questions. What are your concerns?
Right.
Right.
Well, one of the things I know we wanted to get to today as well, and obviously it's something on people's minds even outside of the timing, but the government shutdown. It's got to be on, these things kind of tie together, and there's a lot of people that could get caught in kind of a bad spot there.
My understanding is it doesn't affect, and I believe we've been here before. I don't know what the last time we have a government shutdown. I don't think it was this time of year. For some reason, I think it was in the summer.
Okay.
But I don't know if we've ever had it during Medicare season.
Right at the same time, right.
My understanding is, I just read this morning, Medicare goes on.
Okay.
Now, I don't know if those people get paid who work for Medicare. I don't know how that's going to affect their ability to do their job or their mood. But we're going to still be able to do what we do. We're still going to be able to submit enrollments. We're going to find out tomorrow if Medicare.gov's affected.
Yeah.
Because tomorrow we see that's where we go a lot of times to see plans is Medicare.gov. to look at plans, especially prescription drug plans. But my understanding is that will not be affected.
Okay, that's good.
But one thing I do want to talk about that's kind of tied in with this government shutdown is we just talked about Medicare in that open enrollment annual election period. We've got another one coming up November 1st. Mm-hmm. This one is really that's the Affordable Care Act.
Okay.
Also known as Obamacare. Some people might refer it to as Penny now.
Okay.
Because that's our marketplace. The website is called Penny.
Okay.
Where you go to get your health insurance. This is where people go who are retiring prior to being 65, self-employed. Employer doesn't offer health insurance, so everybody who needs health insurance here, Brian sends them down to see us.
Right.
We enroll you guys in a health plan through the Affordable Care Act. So something that you're going to hear in the news right now is the big argument is the extension of the ACA subsidies, enhanced subsidies.
Okay.
So in 2021, while COVID was going on, they increased subsidies, which lowered everybody's drug costs. Everybody's insurance costs who got plans through the ACA. So if you were paying $120, it might have gone down to to 20, lowered it by $100.
Right.
What it also did, Josh, is it removed the income cap to qualify for subsidies to get lower health insurance.
So everybody who was taking advantage, or not in a bad way, but utilizing ACA, everyone who was utilizing it had these subsidies available, and then they were applied, so they got a reduced rate.
They got a reduced rate, and here's what happened. And listen, I went out and said, look, people, if you're under 65 and you couldn't afford to retire, you can right now.
Yeah.
Like, because your insurance was $1,700,
yes,
we can get it for $400, and you can retire. And you know how many people did that?
Yes.
Hundreds of thousands or millions of people.
I guarantee,
came in and retired. Here's our problem. Those people, if these subsidies aren't extended, won't get a dime. So they're going to go from $400 a month
back to 17 or more.
Well, they were never took at 17 because they would have never retired, Josh.
Yeah, okay.
If they would have known it was 1,700.
I got you.
The only reason they were able to retire is because they could now afford it. I don't know what these people are going to do. It's one thing for somebody's rate. I just did somebody yesterday. Lady makes $26,000.
Okay.
$26,500. Her insurance is $20. It's going to $120 next year if these subsidies aren't.
That's a big difference.
For somebody making $26,500, Josh, that's a big difference.
It is, yeah.
That's 5% of there's 5% of their income.
That's a lot.
It's probably almost, 15% of their take home pay.
Right.
So that is a big deal.
Yeah.
And so we're looking at there's 40 million people on the Affordable Care Act. Every single one of them practically is looking at insurance going up between $75 and $700 a month.
Wow.
And so this is a really big deal. So it's being negotiated. So part of the shutdown is Democrats are saying they're not going to agree to anything unless the subsidies are guaranteed to be extended. Okay. These enhanced subsidies are guaranteed extended. Republicans are saying we're not doing that. We need to separate those two things. That we need to get a spending bill, in order first, and then we'll negotiate those following. Democrats are saying we don't trust the Republicans to negotiate that in good faith.
Yeah.
Look, I'm not here to say whether the Affordable Care Act was good or bad. Personally, what should have happened in 2021 was, yes, we're going to do this extended enhanced subsidies, but we're also going to look at reasons why insurance premiums are going up and costing the taxpayers.
Because the system is wrong.
Because the system is broken.
Yeah,
so they should have said, we're going to do this, but we're also going to take steps to lower insurance premiums. That was never done.
Right.
I get it. The ACA is costing taxpayers an enormous amount of money because we keep giving more subsidies out because insurance prices keep going up, so we have to spend more money on subsidies.
Right. But it's like it's putting a Band-Aid on an open giant wound.
Here's the thing, though. Now is not the time to just yank this out from under people.
Yeah.
Because back in 2021, we hadn't seen this crazy inflation yet.
Right.
And so we lowered people's premiums and we gave them extra subsidies. Those people have budgeted for that now.
Yes.
And in between when that happened and today, their grocery bill went up. I don't want to hear the 7%, 12%, 11%.
No, I know. I go
you
grocery
don't tell
shopping.
me you go grocery shopping. I'm telling you, man, it's doubled.
It's huge.
Yeah, it's not. No, there's no 11% price increase. I shop.
It's huge.
Yeah,
Nothing has changed yet. And again, this is not
Right.
Democrat or Republican.
No, it's not Democrat or
they
Republican.
They both can get up and yell about
Right.
it. But if I go to the store now or like a couple months ago, it's all bad.
Nope.
It has been bad.
Nope, it's not gone down.
Right.
It's still high. Prices are still high. We used to pay a couple bucks for a jar of ketchup. It's like $7 now. You're like,
Right.
that ain't 10%.
No, it's not.
You know what I mean? Like, yeah, my bananas might still be 49 cents a pound.
That's the only thing you're getting.
But the other stuff is still. I just can't believe. I paid It was a candy bar was $4, Josh.
I know.
I don't eat a lot of candy.
Are unbelievable.
A king size candy bar was I couldn't believe my mind. I walked
know.
up talking to myself. The lady that rang me up thought I was an insane person. I'm like mumbling under my breath, screaming, yelling, "What the heck?" You know. It's what I'm getting at is now is not the time just to yank this out from under people. And on the 1st of January, their premiums go up like that. It's not the time.
Right.
Okay. What we need to do, and what my opinion is it needs to be, look, we're going to do this for 1 or 2 more years. And the Democrats need to get on board with this too. But we are going to fix this.
Right.
Okay.
There has to be a strategy.
There's
got to
be a strategy.
It can't be just cut it off.
Okay. Here's an easiest strategy. I'm going to make everybody understand this. This is easy. There's an easy way to do this.
Okay.
They've got to get in a room and pass a law, Democrats and Republicans, that is going to force Big Pharma to sell drugs to our pharmacies in the United States for the same prices they do in Europe and in Canada.
Okay.
And that would solve the problem.
Okay.
That would solve not all of it, but that would solve 50
A big chunk.
That would solve 50% of our problem we have right now.
Okay.
Is that Ozempic in the United States costs $1,000. We talked about that.
Yes.
And Eliquis costs $600.
Yes.
And in Canada, it's $400 for Ozempic, $600 cheaper, and Eliquis is only $40 instead of $600. Okay,
Yeah.
So if we did that, we could automatically reduce premiums, and the taxpayers would save some money, and maybe we could keep the extended subsidies because guess what? The taxpayers wouldn't be instead of that premium being $800 for a 62-year-old. It might only be $400.
Yeah.
It might only be $450
Right.
instead, and so the feds don't have to come up with as much money to subsidize that premium.
Right.
And so that needs to happen. Unfortunately, both parties are in bed with the big pharma lobby, and there was something on the news today. Matter of fact, I got a call before I came on the radio. Did you see Trump's agreement with Pfizer and blah 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 blah? And I'm thinking, oh wow, this sounds great. And I looked at what the actual agreement is. It's so limited in scope.
Yeah.
That it's not Pfizer selling
Sure.
pharmacies at the price of the drugs. It's like, okay, it's for Medicaid recipients, and then they're going to have a website where they're going to sell people direct.
Right.
Sell them direct. It almost made it sound like to me they're looking for an alternative. They're looking for an alternative to extending this ACA subsidies, and they're going to try to sell us that. Oh, now you can get your drug for $400 without insurance.
As a win.
As a win.
Yeah.
It's not a win. Or
Right.
somebody on medical assistance.
Right.
That's going to cost. Now that's a good step.
Yeah.
Look, if the government doesn't have to, it can only pay $300 for a drug instead of $600. That's great. But as far as me and you,
Yeah.
Josh, or my Medicare client, that doesn't help them. They're not on Medicaid.
Right.
Okay, that doesn't help them lower their premiums.
Right.
And so again, don't be sold by this.
Sure.
The drug companies are supposedly coming to play. Anything short of drug manufacturers selling medications to our pharmacies at the same prices they do in practically every other country in the world
Right.
is not a victory.
Right.
Okay.
So, and I think too, and I think that what you're hinting at and what you're bringing up to is a really important topic. Obviously, you can get pretty far into the weeds with the politics of it all, but everything's very nuanced. And when you talk about tariffs and you talk about big pharma and all that stuff, there's nuances to every single
Yep.
aspect of it. So when one side or the other tries to claim absolute moral authority or victory, none of that is usually true.
Nope. There's
Yeah.
one. Yeah. Listen, these guys can get in a room and hammer this out if they want to. They just
Yeah.
don't. They just don't want
Yeah.
to for whatever reasons.
Yep.
Whatever. I'm not here to get in a Democrat versus Republican. I'm so over that right now.
Yeah, I hear you. Me
You know,
too.
I think
Me too.
most of us. I think
Somewhere
most,
in the middle, and we're all wanting to be friends
yes,
and get along.
I
agree.
think most of us are. This whole government shutdown thing. I posted on Facebook about it today. The bottom line is there's hundreds, tens of millions of Americans that woke up and go bust their butt today, working for a living, paying taxes to get by, and what the politicians are all going to be doing today is to see who can get in front of a TV camera and blame the other one for this mess instead
doesn't help us.
Nope. Instead of getting in a room and finding real solutions to real problems that we have.
Agreed.
And again, this is a big this ACA subsidies enhanced subsidies is far bigger deal than this Medicare situation.
Yes.
I don't think people understand it. Now, I don't know why it hasn't gotten more publicity. I'm hoping it hasn't gotten a ton of publicity because I'm shocked that left-leaning news stations and Democrats haven't just come out and just bombarded Republicans saying these guys. I can't believe they haven't done it.
Yeah.
You're putting so-and-so, you're throwing Granny over the cliff. Here we go with that all. I can't believe it. So that tells me I'm hoping that there is a plan to extend the subsidies. I hope.
So you think maybe a little bit of silence around it could spell that there's something there?
Yeah, but
maybe.
you know what? We better prepare for there not to be.
Right.
So I'm going to warn people in that category. So here, again, the biggest concern for me is before the enhanced subsidies in 2021, there was a cap of 400% of the poverty level. That if you made 400% of the poverty level or more, you didn't get 1 penny of subsidy to get in a plan through the Affordable Care Act. Okay. A 62-year-old it's $800 at that time.
Yeah.
When they changed that, like I had somebody who makes $80,000 who gets a really nice big fat subsidy. $85,000. They get a family, a married couple of two, get a nice big fat subsidy. Their premiums are about $400 instead of $1,600.
Right.
They're going back to $1,600 if they enhance subsidies. And what are they going to do?
Yeah. It's a big deal.
So I'm warning people, you better prepare like it's not going to happen. These people may need to go get jobs if they can find them. But it's not easy for anyone to get a white collar job right now.
Right.
Let alone a 63-year-old going out and getting a job that's going to provide health insurance.
Right.
You better start preparing as if it's not going to happen. And if it does happen and they do it, I mean, you may have to go out and look for a job.
Yeah.
That's the bottom line. I want to warn people this, Josh, while we're on this subject. There are only, and I'm allowed to say companies' names when I'm talking about Affordable Care Act. I can't when it's Medicare.
Okay.
Don't ask me why.
Okay.
There are only 3 companies in Western Pennsylvania that sell real health insurance. One is a company we've not heard of before. It's called Ambetter. They have very small networks, so we have very few people on it.
Okay.
The other 2 that everybody has are Highmark and UPMC.
Right.
So here's what's going to happen if the enhanced subsidies aren't extended. These companies and these snake oil salesmen are going to come out of the woodwork, and you're going to be bombarded with Obamacare options, alternatives to the ACA. And I'm going to tell you right now, if it's not Ambetter, if it's not UPMC, and it's not Highmark, it's not insurance.
Okay.
It's not health insurance.
That's important for people to know.
Don't buy it.
Okay.
It is not health insurance, period.
They're going to try to take advantage.
Those people on the phone, they're going to sell it. It's going to be guys over the phone that are going to sell it to you.
Right.
Anybody who tries to tell you it's health insurance like you have now is a lie. If you get cancer, you need serious medications, you end up in the hospital, 2 things are going to happen. One, if you're life flighted to a hospital and they perform emergency surgery, you're not covered. You're going to file medical bankruptcy, period. You're going to end up bankrupt because they're not going to pay for it. You're going to have maybe they're going to pay for $5,000 of a $400,000 bill.
It's the end of your life, basically, unless you file for bankruptcy. So
now, I can just go to the emergency room. They got to treat me. Okay, they're going to treat you. They're going to stabilize you, and they're going to send you home.
Yeah.
If you want to have some sort of surgery like a meniscus tear or rotator cuff, you tore a rotator cuff and you work with your hand, they're not going to perform that surgery without you paying for it up front.
Yep.
So you're not going to be able to get your care. Okay? And if it's not Ambetter, it's not UPMC, and it's not Highmark, it is not health insurance as you know it.
So don't do it.
You are throwing your money away.
Yeah.
You are better off not having anything than having that garbage because at least you didn't pay $250 a month for it.
Right.
It is garbage. It will not protect you if you have a heart attack. It will not protect you if you have cancer. It will not protect you if you need high-dollar medications.
Right.
It will not protect you if you need a surgery. It will not protect you at all.
Right.
Okay, it is garbage. Don't buy it. Now, again, I want to reiterate, we're not talking about Medicare.
Right.
I don't want people to panic and say, oh my gosh, I have a plan that's not Highmark or UPMC, and Aaron just said,
This is just for the ACA.
We're talking about Affordable Care Act under 65. We're not talking about those on Medicare.
Yep.
We're talking about people that use the Affordable Care Act to get their health insurance, and we're not talking about people who are employed and getting insurance through an employee.
Through the company.
Through the company, because there are other... Because Aetna and Cigna...
They can hire private.
Yes, the Aetna and Cigna do offer employer group plans, but I'm talking about people who get their insurance because they're self-employed, they work for a company that doesn't provide health insurance, or they retired early. That's who I'm talking about.
Okay. They need to be very careful.
You got to be, again, our phone number
Call you.
works.
Yeah.
You can dial from your cell, from your home. It rings. We will, when in doubt, just give us a call.
Yeah.
We're here as one thing we do for the community is I bet you we probably do 2 or 3 or 4 or 5 applications a day, Josh, for people who qualify for medical assistance, for PACE or PACENet, for something called MOD, Medical Assistance for Workers with Disabilities. I bet you we do 5 of those a day. We don't get paid to do that. We get paid. We do that as a service to the community who's supported us.
Because you're helping everybody who calls you.
Listen, this community has been unbelievable. We've been unbelievably successful in Fayette County, and it's because of the people here that have come to us and trusted us and been with us for 15, 18 years. Anybody who walks in that door, if we find out they qualify for something, we do the application for them. We don't get paid to do that.
Right.
There's no commission in that for us. So pick up the phone and call us. We'll walk you through. We'll walk you through stuff. We'll do our best to find alternatives. And we all need to just listen. Don't get involved in Democrat Republican here, man. These subsidies need extended.
Right.
It's
Until
easy,
there's a plan.
If it's easy for you to say, well, I'm not on it. I don't care. I don't want to pay my taxes. I'm going to tell you something right now. You know people that are.
That's correct.
40 million people.
That's right. It's going to affect somebody you know.
That's
and care
over
about.
10% of the population.
Yep.
I don't know what the percentage of adults are that are on the ACA, but it's probably 20%.
Yeah.
I mean, so 20% of adults in this country use the Affordable Care Act.
Yeah.
They're going to get hammered.
Yeah. And it's going to change everything. And that has trickle-down effects all across. So
I'm glad you said it. I'm going to tell you what it's going to trickle-down affect. It's going to affect rural hospitals very badly. It's going to affect our wonderful hospital that we have right here in this town that's finally got its head above water.
Yep.
Right?
Yep.
What's going to happen if these aren't extended? They're saying 25 to 30% of people are going to go uninsured again.
They're going to go to the ED every time they have something wrong.
They're going to use the emergency room as their insurance, as their health care coverage. And they're not going to go get the preventative care. They're not going to get things done. They're not going to see their primary. They're not going to go to their specialist. They're not going to get their medications. And they're go to the emergency room. And 2 things. One, it's going to clog them up.
Yep.
And then when we need to go, it's going to be a line out the door. 2, they're not going to pay their bill because by law they have to treat those people.
Right.
Those people who are there are not going to pay that bill.
Yep.
And our hospitals are going to get in financial trouble.
And we'll be right back where we started.
And we're going to end up and hospitals are going to hospitals are going to close. Hospitals are going to be in bad shape. It's going to get ugly. And so you are affected by this.
Yeah.
And I know that it's bad for the taxpayers right now. So hopefully, and I do believe that if they do extend them, it's going to come with the caveat that we are going to fix this. We are going to do X, Y, Z. And maybe this thing they announced today with Pfizer is part of the step for it. And that's got to be part of it.
Yeah.
There's no other solution other than, first of all, any solution to rising insurance premiums has to start with prescriptions. If it doesn't start with prescriptions, forget it. We're wasting our time.
Yeah. So that's where the money is. That's where potentially like you said, they're in bed with things. That's where we can make the money free up.
That's it. It's I'm telling you right now, if we lowered costs for prescription drugs to the same they are in every country, I think it could save taxpayers half $1 trillion a year.
Wow. $500 billion.
Maybe more.
Yeah.
And we're talking about on save employers money, employees money. I mean, it would be an unbelievable thing. For people. So again, I know we're running out of time.
Yeah. Last minute, what do you want to tell people?
Listen, if you got questions about Medicare, got questions about the ACA, Obamacare, 724-603-3403. Just give us a call. We'll talk you through it.
Yeah, and this is the time for people to call you.
Yes, this is the annual enrollment period is upon us for both of those. So we're in the time when you can change, make adjustments, and do all that stuff. Now's the time.
Right. And so if they just even have questions, they just feel uncomfortable or concerned.
Yeah, that's it.
Do it ahead of time. Don't wait till you get the email. Just call you today.
Yeah, you can call us now if you've got any questions. It's confusing. We get it. You're getting tons of literature in the mail, tons of books, tons of calls. emails, unsolicited. Just call us.
Yeah.
We'll take care of it.
Aaron, it was my pleasure. I had a great
Awesome,
time.
Josh.
Time flew by. I appreciate you being here.
Thanks, man.
Thank you. You are listening to What's on Your Mind. Wrong mic. I'm learning. You're listening to What's on Your Mind. That was Aaron Zolbrod from the Health Insurance Store. Give them a call today, and we are right up against it for CBS News at 2 o'clock.
This is CBS News on the Hour, sponsored by O'Reilly Auto Parts.
I'm Cammie McCormick. The military is designed to handle foreign